Right, welcome to another episode of the Nuclear Medicine and Molecular Medicine podcast, and today we're going to talk to a very special doctor, Dr. Padhy from Singapore General Hospital, and he's got a very distinguished history, formerly being at the IEAA and also formerly being in India. But I'm going to speak to him today about some of his work with warmth, which is a very interesting group of people that are doing a study with therapy and how that works. So perhaps Dr. Padhy might tell us a little bit about what warmth is.
Yes, thank you very much for this invitation, and I'm really pleased to be. Warmth is something called like World Association of Radiopharmaceutical and Molecular Therapy. This is one aspect of actually nuclear medicine. People think sometimes nuclear medicine is only diagnostic, but we also have quite a significant component of nuclear medicine which is therapeutic. We treat diseases by using open sources of radioactivity, and one of the main objectives of warmth is to promote application of radionuclides in therapy, in clinical practice. And actually this concept started many years ago, in late 90s, but only in the past few years it has really taken concrete shape that we have now formed a world association with individual members from all over the world to form this association, which is very actively involved in promoting radionuclide therapy or therapeutic applications of nuclear medicine all over the world.
Well, I think you're right about particularly all over the world aspect, because some of the important things that have been doing, you talked about in therapy, have occurred in places like India or China or even Mongolia. I mean, places we wouldn't think about in terms of some of the work. So, and of course, we're also talking about really probably one of the oldest applications of nuclear medicine. We've been doing iodine-131 very successfully, almost making it a thyroid cancer, a curable disease in many respects. It's taken a long time for us to go beyond that one particular first tracer towards some of these other ones. What do you think are some of these other ones that might be approaching in terms of therapy?
Yes, I think that's a very good and relevant question here. Nuclear medicine started with therapy, in fact.
Yes.
Okay, iodine-131, P32, they are the two radiopharmaceuticals which first used in nuclear medicine. So nuclear medicine started with therapy. And with that also started with so-called theranostics. In nuclear medicine, we diagnose a disease and then we treat. We diagnose the disease with a gamma-emitting radiopharmaceutical and treat the same disease by using a beta-emitting radiopharmaceutical. So that is the diagnosis and therapy. We never treat any disease using radionuclides just blindly, like one can do using the chemotherapy or something like that. You don't know that this is going to, you don't prognosticate to start with.
Right.
Here we first do a diagnostic test using the same radionuclide but which is emitting gamma rays, like iodine-131. For example, bone metastasis. We first do a bone scan using a technetium level compound, which tells us there are many areas of metastasis, and then we use another bone seeking radiopharmaceutical which is beta emitting, which is samarium or strontium-89. So we diagnose and then we treat. So we are very sure that the patient is going to benefit or not much before the treatment started.
Of course, and when we're doing normal treatments with drugs that we give that cost billions of dollars, we actually don't know it's going to work.
Exactly.
But
in nuclear medicine, we have that added advantage that we, beforehand, we can really diagnose and we can really prognosticate. If a bone scan shows hot areas in a bone scan, that means the bone-seeking radiopharmaceutical is going and concentrating there at the sites of metastasis, then you are very sure if you are giving a beta-emitting bone-seeking radiopharmaceutical, it will definitely go there, and then you expect that the treatment will be success.
Yeah, right. So that's far more
scientific and logical.
And you can quantitate it because you can measure the uptake, so we can actually quantitate the actual treatment for that particular patient. So what other things can we look at?
Coming to your previous question, how to take this radionuclide therapy to the developing countries?
Yes.
where the resources are low and the people have no access to routine or the medical facilities, forget about nuclear medicine. Okay, so one of the main objectives of WORM is to do something so that the poor and needy patients in a developing country will have access to state-of-art radionuclide therapy. I can give an example to you. Say, the study that we do when I was in the International Atomic Energy Agency, we developed a new radiopharmaceutical which is called rhenium lipidol, which is a drug which can be used for the treatment of liver cancer. In fact, we all know that the iodine 131 level lipidol was there for many, many years, even many, many decades. But when it comes to the treatment of actual liver cancer in the developing countries, where this disease is extremely prevalent, thousands and thousands of patients, millions of patients in fact, are there, but they just die. In the end stage, we just cannot, they have no access to this sort of treatment.
Right, and liver cancer is more common in places that have hepatitis, for example,
Exactly.
India and China and Southeast Asia.
Southeast Asia. So, how the medicine is there for many, many years, but people are not actually able to no resources to buy them and to get treated. So the main
and well, along with that, a radiotherapy facility costs millions or billions of dollars
Exactly.
to set up, so they don't have access to those
So,
sorts of things.
what the idea here is to teach and to transfer the technology to the developing countries so that they are able to prepare their own medicine in their own laboratories and then treat. So that is how this thing came to our mind, that why not we just provide them a rhenium generator which comes in a box-like thing, and you can just buy it and keep it in the Department of Nuclear Medicine, and you can extract rhenium from that every day practically, and this lasts for 6 months.
Right.
So this is something like technetium generators that you get
Yes.
for
Very
diagnostic
cheap.
purposes. Here also you can get a rhenium generator for the for therapeutic purposes. Keep in the department, and from the rhenium you just do all sorts of labeling. When you label it with lipidol, you can use it for liver cancer. When you label it with HEDP, you can use it for metastatic bone pain. When you label it with colloids, you can use it for radiosynovectomy. So it has got multi-purpose applications.
Yes, and we've already talked about radiosynovectomies on the podcast before with Dr. Moda. So,
Yes.
I mean, yes, so it's...
Professor Moder is one of the pioneers of radiosynovectomy in the world. He has really done a great job in promoting that particular aspect of radionuclide therapy all over the world.
So, actually, it's not a contradiction at all. Radionuclide therapy, even though it's new, has actually got the potential to be one of the most cost-effective treatments, and in fact requires far less cost than setting up a radiotherapy facility in many respects, because you're not building, you don't have the large linear accelerators and other things you need.
Yeah, but you see, you cannot compare. There is no comparison, or there is any competition. That is a different specialty altogether, and so this is when you are talking about radionuclide therapy. This is nuclear medicine. It is an open source of radioactivity which is being used.
Right.
It has got limited applications, but very significant applications.
Right.
And there are only not a large number of diseases can be treated, but there are few diseases which can be like thyroid cancer, metastatic bone pain, liver cancer, lymphomas, neuroendocrine tumors. In fact, in the recent years, it is increasing. The application of radionuclide therapy is increasing slowly, and it is now almost 30% of the total nuclear medicine work in any standard nuclear medicine department.
But I mean, some of the other things we've talked to on the podcast. We talked to Dr. Paganini about breast
Exactly.
radiotherapy, for
Yes.
example, which would be a very cost-effective thing.
In fact, Professor Giovanni has really patented few of those procedures, which is very attractive. And right now, he has a procedure which can really effectively treat breast cancer.
Yeah, and that's an amazing achievement. And even in developed countries, it's hard to get radiotherapy for breast cancer sometimes. You know, adjuvant radiotherapy.
Exactly. So the adjuvant. In fact, about 2 months ago, he was in Singapore, and we were discussing about this particular thing. Probably we may start a sort of multi-center study using that particular technique.
I think that, and of course that technique is something that can be readily used in China or in India or other countries at a much lower cost, in capital cost, than setting up those other facilities.
Exactly. Again, coming back to the role of warmth, see, truly speaking, we are not talking about developed countries or developing countries. As I said, that it's a global.
Yes, absolutely.
It's a global organization. But only thing is, we have to be little. Whenever we think of something, a procedure or a methodology or a radionuclide, we should always think that how the poorest of poor and in a society can benefit from that.
Absolutely.
Because a treatment modality should not only should be for the rich and people who can afford a lot of money, it should be available to each and every individual who needs it.
Yes.
Whether he lives in Uganda or whether he lives in the United States or Kampala or New York, I think the disease is same and the treatment that is required is same.
Yes.
So the main objective of warmth is to make available cost effectively these procedures to patients in societies where there is a need for them and where the disease is extremely prevalent. So that is why, see, I have so much, see, like we try to promote radionuclide therapy with so much of passion and so much of enthusiasm, and I hope that one day we will be able to succeed in our efforts. And warmth will become a real international organization which will be responsible for promoting, not only promoting, educating the people and propagating the real worth of radionuclide therapy around the world.
Well, I think training is an important part of that, and warmth can help with that. The Australian meetings, Australia does a lot more work probably than most other countries in terms of International Atomic Energy Agency training for countries and those sorts of areas.
In fact, we organize large meetings,
yes,
like International Conference on Radiopharmaceutical Therapy, which is called ICRT. We are going to have our 7th International Conference on Radiopharmaceutical Therapy in Finland later this year in November 2012. And normally people from all over the world come, and we have a very novel sort of concept of these meetings. Everybody who attends that meeting, it's something like a self-sponsored.
right.
Everybody pays a lump sum and comes and attends that particular meeting. Normally we have about 300 to 400 participants from all over the world, and there's no registration fee.
Right.
If you are a member of WARMTH, there is no registration fee. Normally people pay $600 or $700 a registration fee for these meetings. We have no registration fee. You just go there and pay for your accommodation and food. And then all our speakers are free. They come on their own, spending their own money, and they pay for their accommodation and stay at the meeting site. So it is something like a revolution like thing coming up, which is happening.
Like a bit like open source software in some ways.
Yes. So this is really happening, and people are coming who are really interested in radionuclide therapy and trying to help others or trying to promote that particular part of science, the nuclear medicine. See, this is something, it's a really a unique concept of this ICRT that is happening nowadays.
So where can people get more information? They can get it from, there's a WARMTH website?
Yeah, there's a WARMTH website. You can say that, and just write ICRT, International Conference on Radiopharmaceutical Therapy. In the Google, it will take you there.
Right. Well, I'm going to put links on this podcast to that site. And if you just put in Google nuclear medicine, it comes up as #1 on the podcast. So that'll make it easy for people to find out.
Yes, please. We're very happy to do that.
Happy to do that, and I'm always happy to help out. And I think the conference you've got in Finland is great. We've interviewed many people from Finland. There's a lot of young, enthusiastic investigators. We had some from Turku on the podcast recently who've done some really good work. So I think that'd be a great meeting and a very interesting place to visit. So thank you for giving up your time. Very much appreciated.
Thank you very much for the invitation.
Okay, thank you.